Hi, I'm Dr. Ed Quirk from Hunt Club Chiropractic. And over the past few weeks, we started a new outreach on social media, especially on Facebook. And it's called Real People, Real Stories. And the docs just wanted to share stories about the patients we have at the clinic going through the spinal reconstruction process, to really reach out to those who are in pain and suffering, to give them hope and to potentially encourage them to come in to see if we can actually help change their story. And so with that, this is Tony's story. So Tony's a 35-year-old with chronic severe neck pain, back pain, and arm numbness. And there's a pre and post x-ray after 6 months. And so there's a few responses from people and questions. And so instead of just replying on Facebook, which I couldn't actually disseminate all this information just with a text back. So I just decided to do just a really quick video just to kind of unpack some of these comments and questions. So actually, comment number one that says, this clearly shows two different head positions, not improving. And then the question by someone else, she asked, followed by a 3-time-a-week treatment for a year or so. And so I just decided to, I wanted to kind of go a little bit deeper into Tony's story. So Tony's story so when Tony comes in, actually the first statement, the first comment, actually he's correct. This does clearly show two different head positions. And Tony is able to bring his head up on the second x-ray here after 6 months. But there's a reason why Tony is in this position at first. And so first of all, let's just unpack this a little bit. The green line is where you're supposed to be. So in the neck, we're supposed to have this nice C shape. It's called the cervical lordosis. And it's supposed to measure from C2 to C7 end plates, 42.5 degrees. At least that's in that general ballpark would be considered normal and healthy. And obviously here, Tony is actually flexed forward, and you can tell that his head is flexed down. And so that is a different head position, but you have to understand why he's like this. So first of all, this is what we would call a reversal of cervical curve causing arthritic spurring and nerve root impingement. And so what we're seeing here is you can start to see how all these disc spaces are nice and thick, but when we get down to C5, C6, you can see there's a thinning and there's bone remodeling starting to happen. So you can hear that it's called spurring sometimes. This is what osteoarthritis looks like. But the reason why Tony can't get his head up is because he also has been diagnosed with a massive disc bulge at C5, C6 here. And so he is an acute episode of symptoms with this disc bulge. He is literally flexed in that position. He cannot bring his head up and back. And so that's correct. And this is him afterwards with the curve starting to come back, and he's able to actually get his head back up and posterior again. And after 6 months, Tony he started off with the chronic severe neck pain, back pain, and arm numbness. And after 6 months, he actually has 95% symptom reduction. And I'll actually unpack this even more in just a second. When we actually go deeper into the story behind what we're seeing on X-ray, is that we actually have to understand that poor posture leads to serious spinal degeneration. So what happens is that as we lose posture, and we can lose cervical lordosis through like trauma, like car accident or sporting injury, head into the boards, or head into somebody's chest, or a fall out of a tree, or a slip and fall at work, car accidents, whiplash. But that change in shape to the spine is always going to lead to serious spinal degeneration over time. And there's a study that came out actually quite some time ago, and it's called a Kapanji study after the author. And basically, for every inch forward of head posture, the weight to the spine increases by 10 pounds. So every inch forward, so we can see 1 inch forward equates to 10 pounds, 2 inches, 20 pounds, 3 inches, 30 pounds of extra weight, of extra load. It's actually called a load moment to the lower spine. And that is published in the Physiology of Joints, Volume 3. And but what's really going on here? So with that extra load, we lose the cervical lordosis. So the loss of cervical curve, that structural damage eventually not only leads to symptoms locally like pain and stiffness and inability to extend backwards, but it also leads to neurologic damage. And how that neurological damage comes about, basically here, so this is another x-ray, and we can actually see here again the disc degeneration here, and you can see here again that little hook, that spur, that's osteoarthritis. So that's the bone remodeling here once again, whereas the other joints are nice and unremarkable, beautiful disc spaces and very, very well-defined vertebrae. But what happens at first is a loss of curve places abnormal weight-bearing stress to the discs and facet joints. So these joints at the back here, they're called facet joints, and some of you have probably been diagnosed with facet syndrome. Well, what happens is these are supposed to be joints designed to receive compressive forces. But when we lose the shape to the spine, we actually now transfer the compressive forces from the back of the spine to the front of the spine, and we start loading up the joints. And because the reversal is happening at C5, C6, this is the load moment. So all that extra load is ending up happening at the C5, C6 area. And so then what happens is the ligaments in the back stretch, those in the front contract, further the lock in the neck into this unhealthy position. So Tony had been going through these symptoms for 10 years, right? But the accident that actually started the process, I think dates 15 to 20 years ago. And so that's why he's so locked and going through an acute episode of disc symptoms, he's not able to move. And then thirdly, abnormal weight is born mainly on the lower segment C5 to C7, which is typically degenerate first. So the lower spine will actually start to degenerate. And then number 4 is the arthritic spurs develop, impinging nerve roots and or cord compression, a compressing of the spinal cord, leading to progressive neurologic conditions. So we can actually see in this image here that we got the spinal cord. The primary function of the spine is to protect the spinal cord because it's the lifeline between the brain and the body. And at different segments, there's these nerve roots that leave these nerve holes, and then we can start to get these arthritic spurs, which is the osteoarthritis. And in Tony's case, he's actually got a disc that starts to bulge out posterior and causing not only nerve impingement, but cord compression. And then we also see that the facet joints that are actually can undergo damage too. And some of you have actually got major pain as a result to this damage to the facets. In spine, also, there's another research paper that came out, and Spine is one of the most well-known peer-reviewed spine journals in the world. And it says progressive kyphosis, meaning as you start to actually not only lose the shape, but go the opposite direction of the cervical spine, resulted in demyelination of nerve fibers and neuronal loss due to chronic compression of the spinal cord. So digging a little deeper here again, obviously we're seeing x-rays, we're hearing the research, but what is truly happening on the inside? So this is part of Tony's story. This is someone that's actually had a similar pattern or problem as Tony does. This is not Tony, because this is what we call a dissection. So we're literally seeing now a person that's been sliced in two, obviously deceased. But what we're looking at is the damage that actually happens. So we can see the vertebrae here, and you can see at the fronts of the vertebrae, at the front of the disc, we can actually see there's a ligament here, but also we can see that the actually discs are nice and well contained until we get down to C5, C6, and we start to see this bulge here. And so we can see the disc bulge here, and we actually can see some arthritis here, the bone remodeling. We can also see some bone remodeling on C6 and C7, and you can see the thickness of the discs here are thick, and we start to see the thinning here, 5, 6, and the thinning here. But the C5, C6 disc also is starting to bulge posterior right into the spinal canal. So this is a spinal canal, so it's a spinal tube. And why they call it the spinal canal is because it's where your spinal cord is. And so what happens here with the spinal bulge And the most typical bulge is posterolateral, which could hit the nerve root, but also can bulge posterior into the spinal cord, causing spinal stenosis. And stenosis is just a fancy term, meaning that there's a narrowing of the canal at this point. There's less room for the spinal cord. And when we get into the scientific terms, subluxation and end plate changes in this individual makes the posterior disc bulge at C5, C6 clinically significant. Advanced disc degeneration is evident at the most subluxated and structurally stressed part of the cervical spine. So what we see on the inside is we're seeing not only the bulge, but we're also seeing the cord compression because of spinal stenosis. So hopefully that actually helps the comment sections. Obviously, Tony's improving with the post X-ray after 6 months. His symptoms are 95% reduced. So yeah, he's definitely improving. The next question, followed by a 3-time-a-week treatment for a year or so. Actually, no, it's not. It wasn't a 3-time-a-week treatment for a year or so. In Tony's case, the specific chiropractic adjustments started at a frequency of 3 times a week, 3 times per week for 13 weeks, and then twice a week for 13 weeks. And that's very typical protocol for a phase 2 degeneration, which actually Tony is in. He's in a phase 2, and there's 4 phases of degeneration. After 6 months, we actually re-X-ray. So that's part of the protocol of correction, the spinal reconstruction in the clinic. And then after 6 weeks, also, we do home care. We did home care with Tony, which is a home cervical traction protocol with a Denerol orthotic. So I'm actually going to just show you what that looks like. So the Denerol is a cervical orthotic. So we can see the loss of curve here. The loss of curve is actually going to cause pain in the upper neck or neck area, base of the skull. It can actually refer pain to the head, causing headaches, migraines, and that's because of the pressure on the cord. And so obviously those are the symptoms. The problem is actually the cord. And this is what the cervical orthotic that we use after 6 weeks. So we actually start off at 3 minutes a day at home, working our way up to 20 minutes a day. And that's how we reshape the spine, is by re-stretching those ligaments out to actually achieve full correction, taking pressure off the spinal cord. And then this is what we're actually after. So we're after not only getting rid of the symptoms, but we're actually after with getting rid of the cause of the symptoms to make sure that Tony does not get worse symptomatically, but more importantly, does not get worse from a structural degeneration standpoint and nerve and spinal cord compression standpoint, because a phase 2 just turns into a phase 3 and a phase 3 turns into a phase 4. And obviously, as it gets worse, there's less and less. The window of opportunity for correction actually closes very quickly. And so, yeah, so that's the question there. And and this is, we're passionate about what we do. I'll actually just show another story, story that you might actually see on social media. This is Vincente's story. He's 32 years old, very similar stories. 32 years old, chronic neck pain, low back, leg pain. This is him before. Now there's a difference here. You can see how Tony's lost his shape, but he's way far forward. In Vincente's case, he actually his head's over his shoulders, but he's got this massive reversal in the upper neck, which is going to produce different types of symptoms in his case. And so here again, reversal of the cervical curve causing abnormal biomechanical and neurological function. And this is him after 6 months, cervical curve improving, associated 75% reduction in symptoms. So this is after 6 months. Here again, same protocol, 3 times a week for 13, twice a week for 13, and cervical orthotic home protocol. And we can get into these details, but why we're so passionate about spinal reconstruction, why we've been doing this for 25 years, changing thousands of lives, is because it's the stories, right? And so this is Vincente. And you'll see some of these photos up on, so that's what he looks like now. And so why do we do this is because it's all about changing people's stories. And not only to get back to the things that we want to do, but also to be able to do the things that we love to do over a lifetime. So I hope that helps, and I hope that encourages a lot of people to see if we can actually maybe change their story. Have a great day.